There we go. We're going to be able to take your questions via the computer. If you'll go to the right side, you can type in some questions once you have them, and we'll try to get those answered. And we'll answer the questions as for each topic. We'll do it all at one time between the topics. So next we can go to the agenda.
Let's see if it works. Okay.
There we go. And I think that AC sent a copy of this out yesterday as well. So just kind of want to let you know of the items that we're going to be touching base on today. So next one. And Barbara, do you want to go ahead and start with your malpractice program?
Okay. Hope everybody's doing well this morning and trying to stay dry. I just wanted to give everybody an update on some of the programs that we have at Kids Health First. First up is the malpractice program, which is doing really well. I wanted to remind everybody that when you have terminations, whether it's a physician leaving or mid-level leaving your practice, that you do need to notify me so we can get them off the malpractice policy. If a physician is leaving, then they also need to make sure that they have a tail policy in place, and our broker can help with that. So timing's kind of an issue with the physicians. If they don't have tail in place for them, it could be disastrous for them. So if you'll just make sure that when you are sending in any terminations that I get copied on that, I'd really appreciate it. And then the second thing I wanted to say about our malpractice program is to please make sure you are reviewing your invoices each quarter. This is a manual process, and we do our best to make sure that there aren't any errors on invoices, but it is a manual process, so there are times when a mistake is going to be made. So if you see anything or anybody listed on your invoices that shouldn't be, if you'll just let me know, I would greatly appreciate it. So if anybody's showing up on your invoice, then it's on the roster that TDC has. And this is a good way to also make sure that you're letting us know of all the changes, especially when it comes to mid-levels. The next slide, please, AC. Okay, so we have some good news about the wellness program. So we did get some feedback that some of the items that we had for the wellness program were a little too stringent. So we heard everybody, and we met together with our broker and also the wellness committee and our board, and decided to kind of loosen up some of the criteria for the wellness program. So now you need to just get your screenings done every 2 years instead of every year, and turn them into Vextra. So all your current employees won't have to do anything if they've been on the program since we did the wellness program until 2016. And new employees have 6 months from their effective date of coverage to complete their screening for the premium credit to be effective. And this will be effective the first month after their following the date of their screening. And then their screenings will be good for 2 years. And then if anybody has any questions about that, just please just contact me at the office either by email or give me a call on the phone, and I'll be happy to talk to you. We feel like this new program still achieves our goals, which is to have healthy employees. Encouraging our members to do these screenings can help save money in the long run. Screenings help catch serious illnesses earlier and many times with better outcomes. Okay, the next slide, AC, please. Okay, so our vaccine program. So the credits for the 2014 vaccine program will be included in your May Kids Health First dues invoices. The average practice offset was 24%. And then I also wanted to let everybody know that I'm actually going to be the contact going forward for the vaccine program. Liz has done a tremendous job in starting this program and ensuring its success over the last several years. This is one of our better programs, and she's just done an excellent job with that. But we're just freeing up her time to concentrate more on clinical integration and quality management for Kids Health First. So I am taking this program over. So we just kind of wanted to let everybody know that. So if you have any questions about the vaccine program, just start sending your questions and concerns to me. And that's it. And again, if you have any questions, just please don't hesitate to give me a call at the office. Thanks.
If you have any other questions, if you'll click that little chat box, you can type in a question there as well.
Okay, next, benchmarking. Well, good morning, everyone. We'll be sending out, the top codes is complete for those of you who participated. Thank you very much. There are some codes on there. AC is going to be reaching out to our coding resources just to get some clarification on. I know there are 2 codes with a couple practices I think that are older codes that we're going to be reaching out to those practices individually. And then the list has been approved by the contract committee, and so it is posted on the intranet site, and I will email the Excel file out to practices so you guys can have that and sort it, or and you know, you can do it formatting changes in Excel. Salary survey, we were going to have this back to you guys today, but as of Monday we only had 26 participating practices in it. Last year we had 34. So I felt like we had an opportunity to get a few more because, you know, the more practices we have, the more accurate the data is. So I am chasing those last practices. If I don't have them by tomorrow, Friday, then I'm going to go ahead and start working on calculating the results. There are a few questions I've been holding off on the benefits questions that I'm going to be reaching back to practices on Friday just to get more clarification on. I'm trying to get it as most accurate as possible this year with some of the questions on the benefits page. But if last case scenario, we'll be getting you the results by a week from tomorrow out to practices. And if you have any employees that you would like to know in the interim that you need some salary or hourly ranges for, just email me, and I can go ahead and send you back that range for that that employee. The practice benchmarking survey that's gone out at the beginning of March. It's due at the end of this month, and if we have any new administrators where you guys have not participated before, or you don't feel comfortable in pulling the reports and submitting the data, please just give me a call. I'm happy to walk you through it and answer any questions that you might have. Right, next slide. The patient satisfaction survey results. The quality committee looked at the results for the network, and they elected to focus on 3 areas. One is wait time. That question read, for your wait time less than 30 minutes from your scheduled appointment time. So we're in the process of I'm emailing the practices who were scored in the top 5 practices, or I think we're now even going to do the top 10, and email those practices to see if they do any, if they have any best practices. Are they doing anything different? And we're going to communicate this information to you. The next question is, do the providers seem to know the important information about your medical history? The quality committee felt this was an important topic, and I've reached out to Susan Marr at the Doctors Company to see if she has any recommendations or any helpful tips for us to help address this question. And then the last question we had for opportunities for improvement is the discussion of preventative medicine at the visit. Now, the committee does feel this is a little tricky because when you tell patients about seatbelt use or bicycle helmet use or any of other preventive services, they may not know that's a preventative service or a wellness discussion. So we're going to try to clarify that question for next time, but also provide some education opportunities for that area. The next thing that we're focusing on this year is the 2015, the accessibility audit. We do this audit every other year. What we're going to do differently this year is that more of the national standard has moved towards, usually we call them secret shop practices in previous years, and we ask them, okay, when is your first available well visit, and when is your first available sick visit? The first available well the requirement from our policy is within 30 days, and a sick visit is within 24 hours. And these requirements come from our payer contracts, where they have we have a responsibility to the patients to have a well visit in X amount of time frame, and different payers have different time frames. But it is the 30-day in the policy, and AC is reaching out to all the payers to make sure that this is the same. Nothing's changed in the past 2 years as far as what their policy is. So we do secret shop practices. We're going to be doing this in June. We know this is the busiest time of your year. But the thing that we're doing differently, last year everybody passed, so everybody had it within the first available. The thing that we're doing differently this year is more of the national standard has moved to third first available. So in other words, they feel that the first available as far as quality standards, maybe from a cancellation or a patient rescheduling. And so we're going to try to find the first available, and I'm also going to ask for your third first available. Now, one thing I have been reading about, and I'm probably going to reach out to some of the administrators, is within your practice management system. Some of the literature does say that you should be able to pull this. So I may reach out to some of the administrators and see if this is something that you can pull with your system. And if you have any questions about accessibility audit, you can either click on the chat box, or you can ask me throughout the webinar today. The last thing that we're doing, the two last things that we're doing, is the Strong for Life provider audit. As you know, it's a requirement that all Kids Health First providers become Strong for Life certified. Children's just came out with their schedule for 2015, and so we have 17 who have not been. So I'm going to reach out to those practices and those providers and provide them with the training schedule from Children's, and then we'll give them until August or September to become Strong for Life, receive that provider training. The one other thing that we've not determined we're going to officially do this year, we're looking into it, is a well check forms audit. Part of our policy is that anytime we have changes to the minimum standards on well checks, we audit the practices after those changes. We're still in the process of looking at the guidance and the what the preventative messages are. So we're not sure if we're going to audit the forms this year or still roll out some helpful information. Next slide. Okay, and I just wanted to remind you that the CINs, which is the Children's Care Network, the activities that they're still looking for focusing on for primary care is like the HEDIS measures surrounding the well checks, you know, the 0 to 15 months and the 3 to 6 years and your adolescents, the immunizations, developmental screenings, coding for BMI, and we know this is something that not all practices are doing right now. So we're researching a little bit information about the appropriate coding and which payers are accepting the coding without any issues, and then the concussion program. So those are still the same activities that nothing's changed. Those are the ones they wanted to focus on in the first year. And then AC, did you have some, did you want to update practices about the McKesson?
I did. Just a quick a heads up that they are reaching out to practices, so you should expect that call or that email to get the process started. Be mindful that when they do the installation call, that it could take upwards of an hour, possibly more. Be also cognizant that the computer that they install it on will be unavailable during that time frame. So make sure that you want it installed, or whether that it's installed on the computer that you can give up for that time frame, and that it's the computer that you want that program to be running on in the future. So typically I would recommend your biller's computer, or again, one that runs your claims, or one of your PA systems or your EMRs. Anything that's going to have your claims data would be the best thing for you. If you have any questions or concerns about the process, I'm here for you. Give me a call, send me an email. I can walk you through it. I can connect you with McKesson if you're having issues. But we're just here for you. We don't want anyone to think that you're out in the cold and that this project or this tool isn't going to be as great as we are hyping it to be. And that is all.
Okay, next slide. United Healthcare. First, job well done, everybody. If you guys remember, we signed the United Healthcare contract about 1.5 years ago, and they had a pay-for-performance measures around increasing our generic prescription utilization and decreasing our out-of-network labs for United. So the terms, just refresh your memory, the terms of the contract, They went into effect May 15th, 2014. It's binding for 3 years. We received an initial rate increase of 5% that was effective May 15th, 2014. And then we've been reviewing the data. We've been measured for 2014 from May until December. We were notified that we did achieve the maximum of 3% increase, so great job, everyone. And then that 3% increase will go into effect May 15th this year. And now we're being measured currently now from December 2014 through December 2015 for their year 2 performance measures, which are the same generics and labs. And if we hit the measures, we still have a potential of 4.5%. Now this 4.5% is not cumulative. So it'll go back. Well, it'll be 4.5 added on to the initial 5%. We don't get 5 plus 3 plus 4.5. So where we're at this year is if we don't hit the targets, and after we've got the 3% increase, we could potentially lose that 3 if we don't hit the 4.5. We won't be able to add that 4.5. So just to make sure, we're going to jump back to where we received that 5% increase, and then we have a potential for another 4.5 increase on that. Next slide. Okay, so just the in-network labs, how we have to perform is our baseline from 2012. Just like how we don't, the percent increase is not cumulative, we still revert back to the same baseline. So if we do exactly what we did this year, we'll hit that increase again, forget that 4.5. So I want everybody just to keep trying to do what we're doing and not change anything. For the unless there's opportunity, and I'll get to that in a minute. But the in-network labs, our baseline was 4.8%, and what that means is that the United LabCorp is their in-network lab, that we referred to an out-of-network lab 4.8% of the time. So in our 2014, we're able to decrease the out-of-network lab referrals down to 3.2% of the time. So we hit that goal, and then we received 1% there, and then the 2015 goal is, again, to have that 4.8 or less. Generic prescriptions, the baseline was 64.8%, which means we prescribe generic prescriptions 64.8% of the time. Our performance goal for last year from May to December, you guys did fantastic. It was we prescribed generic 70.5% of the time. And just to refresh, remember, we in no way want care compromised to patients, but we do feel that if there is an opportunity there that you could prescribe generic, it's obviously less expensive for the patient, and if there's an equivalent option for the prescription. Our goal, again, reverts back to that 64.8, and we need to increase that by 3.56%, so that our new goal for 2015 is 68.4. So again, we've already hit that goal. We just want to keep doing what we're doing. So thank you guys for all the effort that you have put into this program. Next slide. Okay. One last thing about United. One thing I'm working on right now is get all the practices data. I have received it from May to December. So if you have, and I'm sorting it out and trying to provide it to each practice, and what I would like for you guys to do is take a look at it and see if there's any opportunities. Like within your office, is there any prescriptions that you feel that you could move to generic? So if you have a practice meeting coming up anytime in the near future, just please let me know, and I'll go ahead and get you your data first and get that information to you. Otherwise, I'm just going to start working through them and emailing them out to practices. You'll receive an email from me with instructions and 2 other files for the network. The data is actually going to be coming from AC because it does have date of appointment and from the prescription given. That is HIPAA information, so she's going to be sending it via secure email. And if you have any questions about this United contract, please give myself, Sylvia, or AC a call. Okay.
Thanks. Thanks, Liz. Barbara, did you want to address a question that had come through on the chat?
I'm sorry, Sylvia, I didn't catch that.
I'm sorry. We had a question on the chat. I don't know if you can see it or not. It's not.
I can't. So if you'll just list it for me, I'll see if I can answer.
It's about the wellness program, and it.
Okay.
Donna was asking if we could send a form letter. Hang on. Oh, Well, I just lost my screen there.
Here, it's right here. It might be helpful if
Thank
Kids
you.
Help First did a form letter explaining or reminding about the program at the office. The employee can fill the name and their last wellness visit, just to keep them informed of when the last one is, I guess.
Okay, I can work on that.
And then there was a question I see too about the McKesson.
Hang on a second. About sending an email to the rep asking if they could work with Navicure on the clearinghouse. Many people use that. AC, do you know whether or not they're working with specific, or Liz, I know you've been working with this a lot too, specific companies regarding getting that data?
I'm not sure. I can answer
Okay.
that after though.
But we can check on that and get back to you on that.
Okay.
And
We have a call this afternoon, so I think we'll maybe find out some more information.
Okay. Anybody else have any other questions really quick? And Jessica, I know, was having a little bit of problems with her audio. Do we have that fixed?
Can you hear
Is
me?
she able to get in? Jessica?
There she is. We can hear you.
Yes.
Yay!
Well, let me just kind of briefly explain why we're having a credentialing presentation, I guess is what I don't know this is called a presentation, but a refresher. We've actually been having a few problems with some credentialing applications coming in, not necessarily being all complete, or we've had some problems getting some data that we've needed to fully credential, or practices that may not have gotten us, particularly with Medicaid numbers, and Jessica's going to address that in a second. So we thought it would be a good idea to go ahead and have her talk about the credentialing process so that you kind of go, you know, exactly what we have to have again and go through. And we will have her, this webinar, by the way, is going to be recorded, so if you wanted any of your billing or credentialing staff to actually listen to this, we'll actually have this on our intranet portal so that they can actually access it and listen to it as well. And we will be emailing out all of the documents that we have for the webinar out to you all as well. So Jessica, take it away.
Great. Can we go to the first slide, Macy? There we go. Okay, so this only applies to our malpractice participant practices, but before you hire, we do want to remind you that you do have to do the pre-screen. You can access those forms on our member portal and let AC know if you're having any problems getting on that new portal, or if you need to get registered. She can help you out with that. Once we pre-screen, Christine will email you and let you know that we need to begin the credentialing process. We just wanted to gloss over that to remind you. Okay. The next thing that we wanted to remind you of is that it can take a really long time for the state to get Medicaid numbers going. So we want you to contact them immediately, as soon as you can, to get that started. Even if your physician has worked for another practice that took Medicaid, they need a specific number to your practice. It's actually going to be the same number with a different letter at the end. But they have to have a new one for your practice. They will also need a number for each location that you want them to see patients at. You cannot see CMO patients at all until they have their own number. You cannot bill under another physician. If you do so, those funds could be recouped and you cannot get them back. It's just completely against the rules for the CMOs, and I know it's different than commercial, so just need to be aware of that. Also, we cannot submit your physicians to the CMOs to add them to the contract without those numbers. They won't even start the process, so we have to have the numbers first. So generally what happens if we don't have your numbers, we'll go ahead and send everything to the commercial payers, and then we'll wait to send it to the CMOs until you give us those Medicaid numbers. So just a very generic, 1,000-foot overview of the credentialing process. We receive the complete application. We process the application in our office. We take the candidate before the credentialing committee on the first Tuesday of each month. If the credentialing committee approves that candidate, then we take that candidate before the board, which is the second Monday of each month. We have this scheduled so that it's within a week usually. We approve them at the credentialing, and we approve them at the board, and then we send them on to the insurance company the week that the board approves them. So they approve them on Monday. I usually get them out on Wednesday. And then Kids Help First checks the effective date 45 days, around about 6 weeks after we send them off to the payers. We give the payers plenty of time to get them in the system, get all their kinks worked out. We only check the effective dates for like the big guys, so United, Humana, Cigna, Aetna, Coventry, etc. We don't check all the Galaxy and Evolutions and all the little ones, just the big guys. So you can check in with me around about 6 weeks after your candidate goes, and I should have those effective dates. And if not, I'm working on them, and I'll get them to you ASAP. The physicians must be credentialed every 3 years, so it's a 3-year cycle. Now, sometimes we may ask you for individual physicians earlier than 3 years, say you have a new physician come in. We generally try to catch any new physicians, the kind of onesie-twosies, catch them up with your whole practice. So we're not asking you for credentialing applications, randomly, like throughout the year. We're asking you in one big lump. Okay, we're ready for your practice. Send us all of your doctor's re-credentialing applications. Okay.
Sorry.
Okay. All right, so complete application. You can access all the credentialing forms and this is for initial credentialing. So you can access all the initial credentialing forms on the member portal, or if you want to, you can just contact Christine and she can send them to you. We do have a policy in place, put in place by the board, that you must have a completed application turned into Kids Help First within 60 days of the start date, or you have dues penalties. I didn't put the specifics of those dues penalties. If you have any questions about the specific penalties, you can contact us and we can get that specific information to you. But it's basically like you waive your new physician discounts and all that kind of thing. So there are penalties if you don't get an application within 60 days of the start date. Also, we wanted to remind you that we cannot process your application unless it is complete. So it will delay the process. It will delay what month your physician comes in and goes to the credentialing committee if it's not complete. Go ahead. Okay, so this is everything that is required of a complete application. This is all on the member portal, listed out to let you know everything you need. And then there's another reminder on the bottom. We have to have all these forms complete and all these copies to start processing and to take you to the credentialing committee. Okay, I see you can move on. I'm going to touch on a few of the more problematic pieces. Okay, so the Georgia application. We know that sometimes you have office staff or the PA may fill out just the demographic information on the application, and that's okay. They can fill out, the name and the birthday and all those kind of good things. That's not a problem at all. But the physician has to complete the attestation questions themselves. All the yes, no questions. Even if the office staff knows the answers to those questions, it doesn't matter. The physician must complete that themselves. Period, the end. Also, the physician needs to complete any explanations. So if there were any malpractice cases that need explanations, the physician has to complete that themselves. Any work gaps or training gaps of more than 6 months, we need an email or a written, typed out document, fax or whatever to us from the physician. More than 4 years in medical school, we need an explanation. More than 3 years of internship residency, we need an explanation. Any failed board examinations, we need an explanation. And any confidential attestation questions answered yes, we need an explanation. And those have to come directly from the physician. Okay, see? Also, we need the physician to review the final application. If they didn't fill in that demographic standard information, they need to check it out and make sure everything is correct, because ideally and in the end, any misinformation that's on that application is on them. It's their responsibility. We also wanted to let you know, this is something that we've come across lately, and it's not something we really focus on when we're talking about credentialing, but we need you guys to know and let the physicians know that you are contractually required by Kids Health First and by our payer contracts to report any and all changes to information or standings once you submit an application. So if someone has any sanctions against their licensure, it happens after you turn in that application, or even once they become a member of Kids Health First, you must tell us immediately, because we have to monitor those things as well. So here's a couple of examples of things you have to let us know. Licenses or certificates are sanctioned or surrendered. It does voluntary or required, it doesn't matter. We need to know about it. If your physician goes under treatment for alcohol or substance abuse and they are being reviewed by the state licensing board, we need to know about that. If you know of any reports that are being made to the MPDB, we need to know about that, or any other reporting boards, we need to know about that. If they're being involved in any investigations with their DEA or their state license or anything like that, we need to know about that. Even if nothing has happened, if there's an investigation, we need to know about it. Or if they had any criminal offenses, we need to know about that. Because we hold your contract, so basically it's on us as well. We need to know, we need to be able to report anything to the payers that we're required to report. Okay. So again, just want to point out that we need you to explain to the physicians that if they do not answer these attestation questions truthfully and completely, or they fail to report any changes to the information after the application gets to us or after they become members, this can be perceived as fraud. And we take this very seriously, and so do the payer contracts and the board, malpractice, we take this very seriously. So we need to make sure that they know that they need to read these questions fully and understand that if they have any questions, they can contact us. But once it's answered and signed, it needs to be correct and truthful. Okay. Another thing that we haven't really asked for this until recently, because we don't need it for all the payers, but we are needing it for more payers actually lately, is a W-9 form. So when you fill out this W-9 form, we actually need it to be completed out as for the physician and not for the practice. So this is what we need on it. We need the physician name, but we need the practice location, and we will need a W-9 for each location. We need it to have the practice tax ID number, not the physician's social security number, because we're basically turning this in to how we want it to be paid. We need it to be paid to the physician with this tax ID number. And then we need the physician's signature and date on it. And we need one for each location signed. All of them need to be signed. Okay. A reminder, we do not have delegated credentialing with Cigna. So when you turn in your initial applications, you turn in 2 original copies. One is for us, for our delegated credentialing, and one is for Cigna, that we send out certified mail to Cigna. And we do that as a courtesy to you so that we can keep up with it. We know exactly when Cigna is getting the application, and we can check in for effective dates. But Cigna does not contact Kids Health First for missing information. So if your application has missing information or they can't primary source verify something on the application, they're going to contact the practice. So if Cigna contacts you for any reason for missing information, if you don't contact them back, your application is being held. And they don't contact us about that. They don't let us know that they're holding your application. The only way we find out is when we get the certified mail receipt that they have it, and we check back in with them and say, hey, what's the effective date? We know you got this application. And they'll come back to us and say, oh, well, we've contacted the practice that we need a copy of hospital privileges, that we can't find them online. So they're holding your contract or your application, not credentialing your physician. We don't know about it until we check in with them, but they've already contacted you. So if they contact you, you have to get back to them. The same goes for re-credentialing applications, and this can be a real problem. If they contact you, or when they contact you and say, okay, it's time to re-credential your physician, you have to contact them. They're not contacting us, and we do not do re-credentialing for Cigna. You have to do it directly with Cigna. And if you do not contact them back about re-credentialing, they will terminate you from the contract. They usually give you several opportunities, probably try to reach out at least 3 or 4 times to your practice. If you don't get back to them, they will terminate you from the contract. And that has actually happened, and we have actually had to deal with resubmitting claims and trying to get backdated effective dates so that we can get physicians paid for those Cigna patients that they saw once they were terminated from the contract. So please, please, please get back to Cigna if they contact you. Okay, and these are the things that can cause delays. I think lately I feel like it seems like it's taking a long time to get new physicians through credentialing committee, and these are some of the reasons why. The biggest one lately is hospital privileges. SHOA takes a while to get their hospital privileges going, and so if you could apply for those as soon as possible, we appreciate it. Once they approve your physician, then we have to find out about it, and then we take your physician to the next month's meeting. So, we don't meet more than once a month. So if we find out, like, right after our credentialing meeting for the month, we can't take them until the next month. So the sooner you can get those done, the better. Also, if an application is submitted immediately before the committee meeting, we actually send physician information to the credentialing committee the week prior. So once we've sent out that information, your candidate doesn't go until the next month if you haven't gotten it in before. I think we usually send it out Wednesday or Thursday prior to the meeting the following Tuesday.
And that's if the application's clean and we don't need any other information, correct, Jessica?
Correct. Right, exactly. If it's complete, we get it in like the Monday before the next week, then it will be okay. But if it's not and we have to reach back out to you, it's still going to get pushed back to the next month. Also, if your application is submitted immediately after the credentialing meeting, we have to wait a whole month until the next meeting. So just keep in mind, we only meet once a month. And also, again, if the application is incomplete or missing information, please, 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 all you have to do is send in everything that's on that list. We let you know ahead of time what we need, so just make sure everything's included in the packet. Re-credentialing, just a tiny brief information on this. We will email your practice with a re-credentialing application when we are ready to go through the process with you. So it'll be at least every 3 years, but could be sooner than that for some of your physicians. This is everything that we need for the re-credentialing packet. You must respond to us too, just like Cigna. If we reach out to you and say, hey, it's time to re-credential, send in your information as soon as possible so that we can get this done in a timely manner. We don't want any of your physicians to go past 3 years. So just let us know if you have any questions. But once we send it to you, that means we're ready for it. Okay. If you have any questions about credentialing, you can contact me or Christine. We're the ones that process all the credentialing and send everything out to the payers. And I actually am the liaison for Kids Health First for the credentialing committee. So if you need anything or have any questions, let us know.
Thank you. One thing we didn't do, and I'm going to ask AC if she can open up and unmute everyone's lines. I'm going to do a roll call by practice name so that we can try to see which practices we're attending today. So When I call your practice name, if you'll just say here. Is everyone's line open, AC?
I'm here. I've unmuted. Everybody's unmuted.
Okay, great. Atlanta Children's Clinical Center?
Here.
Atlanta Pediatric Partners? Bi-County?
Here.
Children's First? Children's Medical Central? Children's Medical Group?
Here.
Children's Medicine? Top Pediatric Associates? Top Pediatrics? Decatur Pediatric Group?
Here.
DeKalb Pediatric Center? Dunwoody Pediatrics?
Here.
DV Pediatrics? East Cobb Pediatrics?
Here.
Gwinnett Pediatrics?
Here.
Dr. Danitz? Kennesaw Pediatrics? Kids First Pediatric Group?
Here.
La Clinica?
Here.
Lawrenceville Pediatrics? North Atlanta Pediatric Associates?
Here.
North Fulton Pediatrics?
Here.
Northside Pediatrics?
Here.
Peachtree Park Pediatrics?
Here.
Pediadoc? Pediatric Associates of North Atlanta?
Here.
Pediatric Physicians? Pampa?
Here.
Piedmont Pediatrics? Roswell?
Here.
Sandy Springs? Snapfinger Woods? And Veris? Snellville Pediatrics?
Here.
The Pediatric Center of Stone Mountain?
Here. Here.
Tri-County Pediatrics? And Dr. Polizas. All right. We will be getting the slides out to you. I see a question here, as soon as possible. Let's see. AC, what are the other questions that might have come in that I can just go ahead and address here?
I've answered Debbie. She asked that we send a listing out of all of the job responsibilities for KidSub First employees. So we would send that. We typically give that out when we go meet with the new PA. It has been a minute since we've seen some of you guys in person, so I'll definitely attach that with today's information. And Trudy, I do see you in the chat room, so I've notated that you are here. And Cynthia's question was that she didn't see the slides, and we will be sending that out.
Okay, guys. Well, you guys stay dry today, and unless there's any other questions, we'll see you next month. By the way, we are having an issue with the auditorium for next month, the April meeting. So it is possible we may be moving the date and or the time to try and find some space for that meeting. And we do have a couple of people to present. And I will just be looking for new dates and times for that meeting. So if you will let us know if you have any questions on that, we'd appreciate it. Thank you all for participating today. And this also will be up, like I said earlier, we've recorded it, and it will be up on our intranet site. Thank you.
Thank you. Bye. Bye.
Bye, guys.
Great one.